Hospitals everywhere are trying to fill a huge need for nurses. Good evening. I'm Ann Emmerich.
And I'm David Andrews. Hospitals are now being forced to look as far as the Philippines to meet their patient demands. News 10's Amaya Kaznicki has more tonight.
The pandemic changed the landscape for nurses permanently. Jeff Breslin has been working as a nurse for 28 years and says something needs to change.
Seen over time, the hospitals talk about bringing in workers, nurses from other countries to help fill the gap.
Henry Ford Health has a shortage of nurses at all of its facilities in Michigan. To fix that problem, the hospital is bringing in 600 registered nurses from the Philippines. In an email, Senior Vice President and Chief Nursing Officer Eric Wallis says, "Our first Filipino nurse arrived this week. We hope to welcome more international recruits later this year." Henry Ford Health says the training for nurses in the Philippines is very similar to the training here in the U.S. The same training that nursing students like Julia Zaretti are going through right now, getting prepared for the workforce.
I'm just excited to come in with everything, new knowledge, and to be able to help patients that are still in need.
Zaretti and Breslin say they think the idea of bringing Filipino nurses to the States is a good one. The more help, the better.
Any help is really important and needed in this time.
We welcome any kind of help at this point that we can get.
Whether they've been in the field for decades or are just starting out, caring for their patients is their #1 priority. Amaya Kaznicki, News 10.
And they're hoping to continue to bring nurses over from the Philippines until 2025.